introduce you. Firstly, thank you so much for reaching out and offering to help international students settle in better and get the hang of things here better. So Dr. Banda Khalifa is a physician and a global health expert. He's one of the only 3 United States Federation Aviation Administration certified first-class aviation medical examiners in the international region. In 2014, he enlisted in the Ghana Armed Forces and was awarded the Chief of the Defense Staff Prize by the President of Ghana after commissioning as the overall best graduating cadet. He served with the United Nations Peacekeeping Mission in 2015-2016, and in 2016 and 2017 as a flight lieutenant to lead Ghana's aviation medical team in the Ivory Coast and Mali. He was subsequently awarded 2 UN peacekeeping medals. In 2018, he gained admission into Johns Hopkins University for a dual MPH MBA program as a summer scholar, and he graduated with honors as a Beta Gamma Sigma member. At the peak of the COVID-19 pandemic, he worked as the manager for COVID-19 response program within the Baltimore City Health Department and has recently joined the Tony Blair Institute for Global Change as the Health and Vaccine Delivery Advisor. Earlier this year, Dr. Banda was awarded the Class of 2011 Alumni Impact Award during the 60th anniversary celebration of the University of Ghana School of Medicine and Dentistry for his immense contribution to his health efforts. He has also co-authored several peer-reviewed publications that several notable organizations, including the WHO, have cited. He aspires to become a physician scientist and a transformational global health leader. Just while going through the introduction, I realized how accomplished you are, and it truly is an honor to have you amongst us today and to hear your words of wisdom from you. So I'll hand it over to you, and you can take it away. Thank you so much.
Thank you so much, Asma, for such an incredible introduction. And thanks everyone for joining me today for the 3rd annual session, which I usually hold it on campus or in my accommodation, but since the COVID-19 began, I haven't been able to host students in my accommodation. So it's interesting to meet all of you, and you are all accomplished. I mean, gaining admission to Hopkins is certainly a testament of your accomplishment. I'll go ahead and share my screen, and then go ahead with a short presentation, which we can then follow up with questions and answers. So as you all know, I want this session to be as informal as possible, because there are no faculty, there's no academic advisors here. It's just students, and we are all going to be students very soon. I'll be telling you guys again in fall. So as by way of introduction, as Asma said, I'm Banda Khalifa, a medical doctor and a public health expert. We'll go ahead and see how we can go through these series of items. The most important ones are, your concentrations and certificates, how to go about grading credit hours, planning your program, which is very important, given how fast the curriculum is. And then the importance of networking whilst you are Hopkins. And then the collaborations you can have whilst at Hopkins, and then we'll go ahead with Q&A. So first of all, huge congratulations to you guys. I mean, you are the finest of all the applicants. I know some of you had options of attending different schools, but I can assure you that this is the best decision you've made. And I mean, after you graduate, you realize the importance of having Hopkins on your resume. So as a snapshot, I started my whole journey in Ghana, went to a couple of UN peacekeeping operations, and then settled with Johns Hopkins for my MPH whilst I was there, I typically MPH MBA will not be recommended to do EPI first concentration, but given my interest in epidemiology and biostatistics, I still did EPI biostats. I also did a certificate in pharmacoepi and drug safety. I worked as a research assistant in 2 departments, epidemiology and then health policy and leadership. I had my internship while in school with Japago in Southern Africa. And then after graduation, I worked as a COVID-19 manager, the Baltimore City Department, and currently working with the Tony Blair Institute for Global Change. In fall, I should be returning back to campus to complete the cycle. So let's dive straight into what we want to talk about. So as you may be aware, I mean, Hopkins has a rich academic environment. Whatever your interest, they have something for everybody. And it's up to you to decide which particular concentration or customization, which courses interest you. So the factors that you should consider while choosing your whether to concentrate or to customize will first of all depend on your interest, right? If you're interested in hardcore research, analysis and all that, then you may want to consider IP biostats. If you're interested in leadership and management skills, you may want to consider concentrating in health, leadership, and management. That's not to say that you can't customize and get all these skills. You can customize and then pick a couple of courses that you think are very interesting to you. What you have to keep in mind is that the customization is a bit complex, and people like to be associated with the concentration so that it can be structured for them. So if you're in the concentration, you know the courses you have to take. The general requirements are a few, but if you are customizing, it's up to you to pick, each and every course that you want to do. So EpiBiostats is structured for you. They let you know, they give you timelines on when to finish your capstone, when to finish your practicum and all that. So that one is laid out for you. So if you're not somebody who is well organized, then maybe thinking of a concentration would be appropriate. And you also have to look at job opportunities, right? You may be interested in food systems or food nutrition and health, or even health systems and policy. But as international students, our opportunities or our chances of landing jobs in certain areas, it's a bit difficult, right? So you have to look at what job prospects are there. I know we all have our plans, as international students. I was talking with Paul a couple of days ago, and he was saying that this batch, we have more than 50% of international student day positions. So, everybody has his or her own plans, but in the interim, you need to make alternate plans in case you don't transition directly from MPH into residency. So you need a skill that will make you marketable. And then you also have to look at opportunities for mentorship. I remember when I was there, one of my colleagues wanted to do healthcare leadership and management, but he realized that for some reason, the department, was not well organized. So she was struggling. Later, she had to switch to another concentration. So you have to look at which concentration or which department is well organized, has opportunity for mentorship and guidance. And then your future intent, right? If you're a physician and you want to go into residency, you want a skill that at least can get you, into publishing after school while you are a postdoc. If you want a postdoctoral position in a medical institution, your best shot is having those analytical skills. And once you have those analytical skills, you can go ahead and do a couple of publications while you wait to get into residency. So these are the main factors that I considered in picking my concentration. For certificates, usually it's like, being a child in a candy shop. There's so much. There's so much you can pick from. And sometimes it gets really distressing choosing between certificates. And it's not compulsory for you to choose a certificate if your course credits won't allow you to. But if you can, you have to choose certificates very wisely, right? So, the factors, first of all, is interest. Are you interested in drug-related issues? Are you interested in global health? Are you interested in clinical trials and all that? So the certificate is an important element that can complement what you're doing for your main, concentration or your main customized courses. So your interest should let you know which specific certificates you should go for. And then, as usual, job prospects. If you complement your epi and master skills with clinical trials or pharmacotherapy, it's easier because most of the certificate courses have some element of linkages, or the credit hour requirements is not as hard if you're doing a particular concentration. So, for example, the extent of overlap with the concentration. So you can do the epi series or the bastard series, and then you pick a certificate and you realize that some of the core requirements of that certificate is the epi series. So you've already covered that one. So you've taken the opportunity of that overlap to make your course load a little less stressful. So you pick your certificate based on the extent of overlap, your credit hours, your job prospects, and then your interest, right? And then, is there a skill that you think you'll be deficient in after your MPH program? And is any of these certificates going to fill that field for you? If that is the case, then you can go ahead and pick that certificate that you want. Now, another important thing is that grading and credit hours can be a bit stressful. Usually, I think for the past 2 years, we started with part-time. You can choose to take most of the courses pass-fail, right? So it's up to you to decide whether you want to take it credit or you want to take it letter grade, or you want to take it as pass-fail. And the factors will depend on course requirements or concentration requirements, interest in the course. If you think you like this course so much and you want it to reflect on your transcript, then you can decide to take it as a letter grade. How the course fits into your future plan. If you think you're going to go ahead and get another degree, a doctoral program, then there are certain courses you may have to consider taking it as a letter grade and not as pass-fail. And then the strength in the course. I mean, halfway you can decide that this course is not going so well for me, so let me switch to pass-fail. Or you can decide that this course is going so well than anticipated, let me switch to letter grade. Because pass-fail will not affect your GPA, right? But letter grade affects your GPA. So you can take all the courses pass-fail and take only one course as a letter grade. If you get A in that course, your overall GPA will be 4.0. The pass fail will not affect your GPA. So I know people use that trick in order to get, a 4.0 GPA at the end of their graduation. But that is not the point. You are not coming to Hopkins to protect your GPA. You are coming there to learn a skill that you don't have. You're coming there to network with people that ordinarily you wouldn't be able to meet. So those are the important parts. And then, as I said, if you're concerned about your GPA, then there are some courses you definitely have to take it as pass fail, right? And then the total time that you're dedicated to the course. Sometimes if you're taking a letter grade, it comes with a lot of stress because you want to make everything look perfect. But the grading system is such that if you want an A, then you should get, I think, at least 90, right? Before you can get an A. So if you want to keep that stress away and say, oh, I just want to pass in this course, then you can just take it as pass fail. In that case, the minimum you need, I think, is 70%. So the credit hours will be due to your course requirement. As international students, we have to take a certain number of credit hours, and some have to be on site in order for you to maintain your visa requirements. And then obviously it's your individual capacity, it's your own choice, right? But I advise people, I've done the West. There was a term that I was taking 21, 22 credits, and it was crazy. And you don't want to be in that situation. So stick to your 18. If you want to, go to the extent, maybe 20, depending on how many certificates you're doing. But don't overburden yourself, because the more credit you take, the likelihood that you will cut corners, the likelihood that you'll not be very engaged with the specific courses that you're doing. So stick to 18 credits if you want, and then make sure that whatever course you're taking, you are gaining the maximum benefit from that course. And then the more credit you take, the less time you have to network, right? And Hopkins, you're not paying all these fees just to come and sit in class. You come in there so that you can meet new people, amazing people. You come there because you want to meet faculties that are impacting, globally. You want to meet new people. So if you pick more credit hours, you'll be in a tighter situation, right? Yeah, so this is how the grading is done. If you want an A, it's 90 to 100. A B is 80 to 89, and a C is 70 to 79. And if you want to earn a pass, I think the minimum you need, especially if you're on any scholarship, I think it's C. So you have to decide whether you want a letter grade or a pass fail. And then we've already spoken about this. You can either customize or you can concentrate. And the requirements, the credit requirements, it's a bit different, right? So if you want to customize, you have to choose between core credits, about 40 core credits, and then elective credits. If you want to concentrate, then it's up to you. Every department has a set of courses that you'll be required to take. And then planning is very important. I know a couple of people who are doing dual degrees signed up for this. Course planning is very important. Otherwise, you'll be overwhelmed with the courses you have to register, the departmental requirements, the general requirements. All those things have to be planned very well. And it takes a lot of anxiety away, right? If you don't know the course you want to do the following term, and this term is approaching, then it becomes a stress. So you have to plan ahead. Pick courses, 2 terms away, 3 terms away, in order to stay focused. And you can use an Excel sheet. I can share this template that you can use just to make sure that you are you are capturing all the essential courses you need to take. You're planning. It's only about 5 terms, right, or 4 terms. So you're planning everything term by term and credit by credit. If you want to take a certificate, make sure you're putting all those courses, all those required courses in your program planner, so that once a lecture begins, you know exactly what you want, right? Otherwise, you get to a time that you'll be confused. And then I've spoken about networking, which is very crucial, right? It's good to have, a stellar academic record. It's good to have your GPAs, but an average GPA would open doors that a 4.0 GPA cannot open because of networking, right? And networking is something that really works in the US. I know in Africa they'll call it corruption, but in the West it's not like that. Networking really works. I know people who got into residency position because the advisor called someone or the advisor recommended them. So you need to know a lot of people, a lot of important people, right? Or a lot of people that you think you may not have met if not for coming to Hopkins. So don't limit your scope to only the public health. If you're a medical person, make sure you're reaching out to people in the School of Medicine. If you're interested in business, make sure you're reaching out to people in the Carey Business School. Broaden your scope and try and network, get a lot of people contact, let them know you. Also get to know your colleagues, because to tell you the truth, 3, 4, 5 years from now, your colleagues will be in, important places that you can just call them and get the info that you need. So get to know your classmates. Luckily for you, you're going back on site, so it's even better. So get to know your classmates, sit at different places, every day. Don't sit at one spot for the whole year, right? Change spots, get to meet new people, talk to people. And then, because the important thing is that Hopkins has a very diverse community, right? And that is the reason why the school is so rich with different cultures, different ideas. So take advantage of that. Yeah, so your cohorts, your faculty, alumni, reach out to everybody. Once you send an email and you let them know you're a Hopkins student, most likely they will respond to you, right? So that's the importance of being a Hopkins. And then you have to also, start building your LinkedIn profile. LinkedIn is such a powerful tool for networking. You can meet, all the alumni from Hopkins on LinkedIn, almost, all the important, critical ones that you need for advice. You can reach out to people, send them DMs, get, advice from them. You are here in your career. You want to find out how they are doing it. It's most of the time they're going to respond to you, right? And then handshake. If you're in Hopkins, you get used to handshake. Create your profile there. It's a good starting point to get job offers or intentions for most of the time for the MPH guys. Create a profile in all the international organizations page, World Bank, United Nations, and attend networking events. I realized this bit close to my graduation, and I regretted it, right? You have to start attending networking events, because those ones are where you meet people, you exchange contacts, and once they see you there, they will remember you, for a very long time. And then there's also the opportunity for you to get a complimentary card. So, for students, the organizations that would plan for a complimentary card for Carey students, for Hopkins, for Bloomberg students. So if you hear of such an opportunity, just grab one, so that when you attend a networking event, you can look a bit formal. And then consulting. There are a lot of consulting clubs at Hopkins, and this is not only peculiar to the business guys, those doing MPH, MBA. If you're doing MPH, you can also join a consulting club, right? And it's extremely important. I know there are a lot of medical doctors, they're not thinking about, consulting or industry or but it's a skill that you can have. If you try it for a term and you think it's not something that you like to do, you can quit. Yes, and then another thing that you have to consider, I mean, social security number. I've written an article about this, how to get social security number as an international student, because the truth is that most of us come in sometimes with a mindset that we are coming in to get our degree and go back to our home country. But then we get to the US or wherever, and then we change our minds by the time we are graduating. So it doesn't hurt for you to get a social security number. It is easy to get it because Hopkins is an environment where there's so much research going on. There's so much work for students to get employed. And once you're employed, you can get a social security number. It's also important to set up your account, get a driver's license as early as possible. And then you have access to credit card. Start building your credit profile or start building your credit history. All these things eventually after your graduation will come in very handy, right? So in summary, public health is collaborative. There is no need for you to be isolated from the pack, right? Make sure you're going, with a group, right? If you want to belong to a study group, maybe 3 or 4 or 5, belong to a study group. It's collaborative. If you have questions, reach out to people, let them explain to you, because it won't hurt. Reach out to friends and alumni as much as you can, right? And those people are the ones that have passed through the system. They know how it works, and they know the mistakes they've done, and they can rightly tell you what you should do and what you shouldn't do. So I think that I'm almost done, but remember to also have fun. It's not academics alone. If there's any get together going on, if there's any party going on, try and mingle with your friends to get to know a lot of people in that particular setting. So I think I've spoken enough. A lot of you guys know where to reach me, and I'll be back on campus in August. So hopefully I'll meet all of you again. But yeah, so if you have questions, maybe this is the time. Questions pertaining to the presentation, or if you have any general questions that you want to ask, I think it's the time that we can do that. So over to you.
Thank you so much. Yeah, thank you so much, Dr. Banda. I think that was a great presentation. And yeah, the floor is open for questions. So, you guys can raise your hands and unmute to ask those questions if you want. So I actually have one. I don't see anyone raising their hands. I'm actually confused about the certificate courses. And I don't really understand as to how that works. I mean, if I'm taking certain courses, and if it satisfies a certificate requirement, do I just get that certificate? Or if I'm aiming for a certificate, do I have to sort of choose certain courses? And I'm kind of confused about that entire process as to how does it go in line with the concentration or customization if I'm taking either. You're on mute.
Yes. So I think that getting a certificate, it's not dependent on whether you're concentrating or whether you're customizing. You can take certificates whether you're concentrating or customizing. Every certificate has a specific requirement, right? Most of them will tell you you need at least 18 credit hours in order to qualify for this certificate, right? So in order to get the certificate, you have to register 18 credits. So they have a list of courses that you have to do in order to earn that certificate. Now, some of the courses that they are requiring you to do, if you're doing a certain concentration, you will still be required to do those courses as part of your concentration, right? So let me use this for example. If you're doing epibiostats, right, you do epidemiology, principles of epi or epi-empirics, and then you do the 751, 752, 753, right? If you want a certificate in pharmacoepidemiology for clinical trials, it is most likely that there are course requirements. Some of them you will need epi, right? So once you've taken the epi with your core concentration, then you've satisfied that requirement for the certificate program. So you just need to take additional courses in order to fulfill that, that requirement. So you may end up, even though they require 18 credits, you may end up doing like 12 or 13 credits, or even 10 credits, because you've done those, some of the courses in other,
I see.
through other means. Yes. So that is how
that makes sense.
That is how it plays out.
Thank you. I see Jane has her hand up. You can go ahead and unmute if you want.
Good day, Dr. Banda. Thank you for the information. I appreciate. Yes. Okay, I have a question, okay, because I'm trying to navigate something. I live primarily here in the US with my family, right? And I'm from Nigeria. And my question is that I also, as much as I want to work here, I also want to like make an impact from where I'm from, like in Nigeria. So like example, things about primary health and improving some health situation in my country. So, but I'm trying to see how I can really navigate that, because it's like, okay, I want to work here and I want to do, make some impact back there. So it's still like, I have not really gotten like a straight path through that. So that's what I want to do, if you have any advice for me.
Yeah, so I think that, I mean, if you want to work in the US and still be able to do some meaningful work in your home country, the best thing for you to do is to establish the credibility, right? Establish that credibility, talk to faculties that have projects going on in Nigeria, and I can tell you, they are, you meet a lot of people who have projects running in Nigeria, Ghana, Mozambique, India, everywhere. So those are the people that you have to talk to. And then once you talk to them, they can let you know whether the project they are doing is of interest to you and whether you can join the project. Because most of the time, if you really want to work whilst you are in the US, is difficult, right? So, for example, when the COVID started, and I wanted to, help Ghana's fight against COVID-19, I couldn't stay in the US because the work required me to be on ground. So I had to come back to Ghana to come and work. So those are the options I'll look at. Look at organizations that have projects going on in Nigeria. Look at faculties that are having other projects running in Nigeria. And then once you get to know them and you talk to them, most of the time they'll be open to, collaborating with you on those projects. Another route is for you to, finish with whatever you want to do now, get established very well, and then you can always reach out to people in Nigeria who are working that you think you can collaborate with them, including the ministries of health and other agencies.
Thank you very much.
Sure thing.
We can have Bhavya ask her question and then Bilal.
Thank you. Hello, Dr. Banda. Am I audible? All right. So I'll go ahead with my question. Thank you, first of all, for your informative session. I wanted to know that on an average, how many concentrations and certificates could one take if I need to have time for, as you said, networking as well? Given the fact that, yeah, it would be time consuming to have too many concentrations also. And my second question is it absolutely necessary to have a job on campus to have a good profile for jobs post-graduation? Or if I don't have one during my MPH, will that be like okay and not looked down upon? Thank you.
Sure. So I think that, so as a matter of fact, right, so you can only belong to one concentration, right? So you can only do epibiostat concentration or healthcare leadership and management or health systems or food science or food nutrition, right? So you can, at any point in time, every student can only stick with one concentration. Now the certificates depend on your capability, right? So you first of all have to look at the requirements of the concentration, how many credits you need in order for you to complete that concentration. And then you can decide on how many credits you can take extra in order to earn the certificates. So give or take, I think, I mean, I know people who have gotten 2 certificates, but that is extremely difficult, right? That's going to drain you a lot. So what I would say is that if you really want a certificate and you're concentrating, 1 certificate should be okay for you, right? 1 should be fine. So if you want to concentrate, do that and then get a certificate that is closely related, or at least that might help you reduce some of the course loads that you need in order to get the certificates. And the job, I mean, we all have different circumstances, right? Some people do the job because they only want the cash, right? Or they need the cash. Others also do it because it will help them use the skills that they are learning, right? So when I was at Hopkins, I was doing epibiostat. So I needed a project that at least I can, start practicing how literature reviews are done, how systematic reviews are done, how to use data to analyze, like raw data and all that. So it's an opportunity for you to learn. Sometimes too, the job that you're doing can be converted to a practicum. If you're lucky, it can also be converted to your capstone, right? So the advisor that I worked with on my job is the same project I use for my capstone, right? So you can get paid and still use it as a capstone, because the capstone it's a requirement already. So it wouldn't hurt for you to kill 2 birds with 1 stone. So I think that, but individual circumstances differ. Okay, if you think that it's too stressful to combine all that, then you don't have to work. I know people who came in the whole 11 months, they didn't work, and I don't think it carries any negative connotation.
Got it. Thank you so much. Thank you so much for your advice.
Sure.
I guess I'll go ahead. So, Dr. Banda, thank you for taking out the time. My name is Bilal, and I have a question related to your work. And I think it'll be great to also discuss your, the work that you've done and the insights you've gotten when you come to campus as well. But I'm interested to hear about the vaccine service delivery work that you're doing with the Tony Blair Institute, and what sort of challenges have you come across in terms of vaccine hesitancy when you're working with African countries, especially with COVID? I'm just curious to hear. So it'll be great if you can share your thoughts on that. Thank you.
All right. So yeah, thanks for the question. I think that it's interesting to be working with, you know, such an organization. This is my first time. I mean, even though I've worked with the UN before, this is the first time I've worked with an institution like Tony Blair Institute. And the difference with this particular organization is that it is highly in connection with governments, right? So you're working directly with governments. You're advising governments. You are embedded deep into governmental structures, and I think that it's what I do as a vaccine delivery advisor on the African vaccine program. It's organizing countries, especially Ghana, to make sure that we are getting the vaccines we need from the COVAX facility and other bilateral agreements. I also have to put data to the work, make sure that we are estimating the right amount of vaccines we need based on our eligible population, and also do some monitoring and evaluation work. In terms of hesitancy, I mean, hesitancy is everywhere, but I think now the main issue we are facing as a continent is vaccine hesitancy. So it's, even though we have the vaccines, people are really adamant in taking the vaccine. So we have to re-strategize our communication framework, increase our social mobilization efforts in order to gather enough people to take the vaccine, because you know there's a global target of 70%, and currently we are around 25%. So there's so much we have to do. So what I do is basically data management, advisory to the Ministry of Health in terms of estimating vaccines and strategies to combat vaccine hesitancy. I do a bit of monitoring evaluation, and I also track adverse events.
Makes sense. Well, thank you for that.
Sure.